And the first team is Cloudmed. They provide health measurements, 8 health measurements in 60 seconds and upload to the cloud for doctors to interpret the data. So that's why we'll call Cloudmed. Thank you.
Hi, I'm Brian, founder and CEO from Cloudmed. What we are building is healthcare at your fingertips. And have you ever thought about who needs healthcare? And let's take China as an example. And actually, every time we came to China, we were very surprised why there are a lot of people in China. And we can see that for China, there are over 400 million people has the chronic disease like hypertension. And the most critical part is that there are over 6,000 people die of a stroke or myocardial infarctions. And we also have near 300 million people are over 50 years old. So those people need health care to prolong their life. However, and unfortunately, the existing solutions cannot satisfy the requirement like the conventional blood pressure meter or the 12-lead ECG equipment or the doctors. And then you know what? Every time we came to the hospital to see the doctors, the average meeting time is below 5 minutes, but it means you have to wait about 2 hours. So this is the problem, and we see. So we are trying to solve this problem, so we provide 4P solutions for healthcare. So we start from providing everyone's health status by using all-in-one eye care solutions. We can measure very important all-in-one bioinformation in 1 minute and upload the data automatically. And then we use our prescribing technique to label the abnormal conditions. And then this is for disease prevention. And the most important part is we use the prediction technique to predict the stroke and MI probability in the next 10 years. Then we collect big data for the correlations, and we divide it in 4 parts. The first is a time-dependent correlation, and the next is a group, the relative, the final is statistics correlations. So we provide a completed 4P solution for healthcare. And until now, we have a very good start. Now we're selling our product over 4 countries like United States, Japan, China, and Taiwan. And especially in Taiwan, we have very strong channels. We have over 200 pharmacy stores selling our product, like Xingyi, like Dingding Pharmacy. And till last week, we have over 50,000 health data in our cloud systems. So, hey, what's going on to that slide? Oh, thank you. So you have to give me back 20 seconds. Okay, thank you. And then to as the mentioned, till this August, we will have over 10,000 members. And then in another August, we also have 100,000 health big data in our system. And we not just apply our systems at home, we also apply our system in institutions. And we cooperate with the China Steel Long-Term Care Hospital to use our system to prolong the lives. And we also provide free ECG prescribing system in Yunnan County for free. So Cloudmed solution not save the money, also save the resource, and also reduce the urban and rural gap. So this is a real case, and the users use our solution, get the benefits. For this one, this is a hypertension people. They measure his blood pressure 5 times a day, and this is a whole week record. You can see his blood pressure is well controlled because he takes medicine every day. So in these conditions, he can well control the blood pressure, so he can decide if the medicine is over or not enough. The other one is that we collect a lot of data. So this HRV analysis is standard deviation per intervals in milliseconds, and you collect from 20 to 90 age. So the system gives a warning. Which kind of warning? Here. So those people are very below the limit. Then you know what? Those people have a congenital heart disease we call 先天性心脏病. So it's very powerful solutions for us. And then is another correlation for relative. So guess what? which one have the better body conditions? Tell me. So I think most of the people like handsome guy, right? So something like the running marathon every day, and the training is hard to very low in 1 minute. So the heart rate only takes about 45 beats per minute. But for all the one, it's near 90 beats per minute heart rate. But by our system point out that young guy has a very high blood pressure. So through the relative analysis, you can see the old one has the better body conditions, but for the young guy, he has insufficient heart functions. These are powerful correlations. So these are ambitions to let everyone have a healthier, longer, and better lives. Thank you. So I can drink here now.
Thanks, Cloudmed. And we will have 3 teams present their company and product, and we'll go into QA time. So now let's welcome our second team, Medjade Technology. They develop medical device for precision medicine to find optimum treatment through AI. Welcome, Medjade.
Good afternoon, ladies and gentlemen. My name is Shawn. This is Medjade Technology. Our product is the novel depression and therapy analysis real-time system. And the technology is based from the National Taiwan University and the Taipei Veterans General Hospital. They are our core members. The technology advisor is Charlie Chong-Ping-Chen. He is the NTU GIE professor, and he is the professor in the University of the Wisconsin in the past. And he is also the Intel R&D manager. And the medical consultant is the Chen Da-Li. He is the TBGH psychiatric director. He is the Secretary General of ASCMP and the Director of TSPPN. And I'm the CEO. My name is Shawn. I'm the NTU GIE PhD candidate, and I'm the research assistant in the TBGH and the NTUGH at the same time. And I have a lot of experience in the healthcare startup, and also the senior engineer at TSMC in the past. Okay. And the precision medicine for depression is a big unmet need. The depression treatment is complicated, long-term, and expensive. The patient has different causes of depression and suitable for individual treatment. So we focus on the precision medicine. In order to find the cause of the depression, we developed the novel depression therapy analysis system. It consists of the manipulating test and the EEG analysis technology. And the system will generate the brain function inception report, and the report will predict the personal anti-depression treatment. And there are our exclusive technology. It could reduce the probability of treatment failure through system analysis. The patients are encouraged to pay for high-price treatment, and there are more than 90% chance to avoid 150,000 NT dollars unnecessary expense. By early confirmation of treatment result, it avoids the waste of more than 1 month. Okay. And our system is very simple and easy to use. We just use the portable EEG device and tag, and our data is stored in the AWS service. And by cloud computing, it could automatically analyze immediately. By AIoT, cloud equipment could immediately analyze at the click. Our product overview is the real-time analysis, accurate analysis. It just needs 45 seconds, and the accuracy is more than 90%. This is the computer comparison table compared to the functional MRI in the past. And the system is very easy to use. We just use in the click. We don't need the MRI center. We don't need the PET center. And our risk is very low, and the accuracy is medium. And the most important, the price is the cheapest. It's only $9,000 NT dollars. Our business model is simple. We use the SaaS service. We just charge $50 once by system use fee, and we will generate the analyst report to the doctor and patient. And this is the major depressive disorder statistics. The global depression population is 300 million experts, and the 10 years of growth is 80%. In Taiwan, and the number of the people grows 23% in 4 years, and there are up to 30 million people per year in America, and there are about 54 million people in China. So I think the market size is very big. And this is the major vision. We developed the EEG device with AI. We hope we can develop a new generation medical equipment. It can analyze all of the mental ills, such as dementia, Asperger's syndrome, and the attention deficit hyperactivity disorder. Thank you very much.
Thanks for Shawn's introduction for Medjade technology. So next, let's welcome Assuretech, dedicated to help people with food allergies. Welcome.
Hi everyone, my name is Gangi, and my company is Assuretech. Just like an estimated 200 million people around the world, I have a severe, life-threatening food allergy. In the 5 minutes I've been given to speak with you all today, 2 people in the United States alone are going to be rushed to the hospital due to a severe reaction. Now, having lived with an allergy my entire life, I have a deeper understanding of the problems that this medical community faces. Now, most people here are going to recognize the EpiPen as the first line of defense against an allergic reaction. The problem is that EpiPens are only used about 30% of the time during an allergic reaction. And this is largely due to the fact that people struggle to remember to bring it with them. Besides that, translating an allergy when you leave your country is absolutely critical. You see that terrible picture of me right there? That was taken a few months ago here in Taiwan. The translations I came over with failed to effectively communicate the severity of my medical condition. It got me into the hospital, barely able to breathe. And then finally, when you have that allergic reaction, your throat starts to swell up. This makes it nearly impossible to speak, to ask for help, to call 911, and eventually to breathe. And this is what causes fatal reactions. So what my team and I are doing is we're introducing simple yet highly effective solutions to these life or death problems. The first way we're doing that is with the Assuretech mobile app. This application was introduced to the market a few months ago and translates the 9 most common allergies in 27 different languages. And then with the press of a button, is able to locate the hospitals nearest to that person having the problem and display a translated message asking for assistance to get that medical help they need. The big idea behind this product is that we're using it to build an audience for an even more advanced solution. And that advanced solution is the Epicenter. And the Epicenter is a mobile application and medical device. First, the application is able to notify 911 or other emergency services, contact pre-designated emergency contacts, and provide another series of translation and emergency-based features. The application is able to translate over 100 different food allergies and does so with an advanced translation system that my team and I have developed. And then finally, the medical device attaches to your EpiPen and wirelessly syncs with our application. Whenever a user forgets their EpiPen behind somewhere, they'll get a push notification telling them to go back and get their potentially life-saving medication. Right now, we have a couple advantages that I just want to point out. The first of which is that we have a patent pending on both our emergency and translation workflows. We'll also be seeking intellectual property on the medical device as well. We do not require a 510K to get to market. And finally, we have an opportunity at achieving first mover status with the AudiQ. That's the device you see on screen. AudiQ is EpiPen's top competitor, but right now there are no medical device companies building anything with the AudiQ in mind. So our monetization strategy works like this. Our aim is to introduce the applications for free. This will help us maximize our downloads, and from there, we'll look to monetize a percent of our entire user base. We'll monetize through sales of our physical device, premium subscriptions to the application, advertisements within the app, and finally, through business-to-business relationships that we've been actively cultivating. So our go-to-market strategy is already underway. It started with the introduction of the Assuretech mobile app. We're using it to start building that audience. The application's been on the iOS market now for 3 weeks, and in that 21-day period, we've been converting at a rate of about 45% and that's without advertising. The strategy after that involves continuing to build on this momentum and introduce our more advanced solutions to this market that we're growing. So in terms of financing this project, that's gotten very exciting over the past couple weeks. It started with receiving grants from Juniata College and also Ben Franklin Technology Partners, a economic development agency in the state of Pennsylvania in the United States that we've been working with. These grants come to us with 0 strings attached, meaning we've taken on no debt and still retain 100% equity. As a whole, to develop the hardware, software, and manufacturing with some initial advertising, we're looking to raise a total of about $200,000. So if we just step back now and look at everything my team and I have been doing, we're creating brand new products and services that can help grow medical care. Thank you.
Thanks for the great presentation from Assuretech. Now is our Q&A time. Any questions from audience about Cloudmed, Medjade technology, and Assuretech? We have 3 questions. Okay, so I invite all 3 stars to the stage for the questions. Cloudmed. So any questions from our audience? I've seen Professor Lee take notes. Can you make some question?
Yeah, this is for the Cloudmed and also the Medjade. I was wondering what's the business model that you have. Is B2B or you want to do B2C? Because your price comparison, I think, is not fair.
Okay, thanks TK. And our business is the B2B, and the doctor will charge the fee about $9,000. It's the hospital's charge receive the cash, and we share the cash about 10%. It's just $30 to $50. Yes.
This is second for both of you. Have you considered into the insurance? For example, the national healthcare insurance, then that might be a way to generate more revenue. So if we can cover by the national insurance in a way, or partial compensation, and your new product maybe will become more popular in this nation.
Well, I'm not quite as familiar with Taiwanese national health care. However, I have thought that the physical device would be a good candidate for insurance companies because on their end, it would save revenue without having to replace lost events. So I think that would be a good option, yes.
More questions? So,
Okay, our model is very simple. We sell our product to the customers, and they decide to pay the service or not. So it's very simple.
We try to discuss with the insurance, yes, because the insurance is very rich. So we want to collaborate with the insurance, and it's the after the FDA 510K the regulation, after we apply the regulation, and we will discuss with the insurance. It's the next step to pay.
This earlier stage, because after you have a product and you talk to the company you are trying to sell to the health company, but if you into, for example, development in a way, and you understand the health insurance people, if they blend it, then you'll help them in a way. And in Taiwan, because everybody's insured, 99% of us is insured by the insurance, health insurance. So if you could take advantage of this, that will be, you have the population, which is almost 100%, and all the allergens and depressions, it's a severe condition which you cannot wait it, because the symptom can be very severe, but how you make a marker to indicate that they need this products, and because the prevention medicine is very hard. You won't take like 10 years of medicine in order to prevent certain things, and you don't know how you do clinical trials that way. So you have to create a marker in a way that I think, for example, your EGG might be, I don't know, because the technology ends shows whether the advantage or not.
Thanks, TK's question. And any questions for Cloudmed, Medjade, and Assuretech? Okay, so I think we can close this session, and till the end of our presentation, you can ask questions to three founders. This is a really tough question. I think I can share about my opinion, not from the capital's view. Yeah. Okay, so maybe I can share from a physician's view. Oh, not from B Capital. Yeah, I'm now a physician, not from B Capital. So for Cloudmed, I wonder why you choose these 8 index to measure. Why not 20 or maybe 100 or more? Why these 8 index?
Because the limit is based on the hardware. So like glucose is very hard to detect without the inject to the body. So I think it's based on the limit of the hardware. So till the technology become very advanced, we can collect more and more health by information. So till now the limit is hardware, like integrated circuit. So it's a limit. Okay.
Got it. And for Medjade, I'm curious about your target market. Yeah, actually, Tsai, depression is become a more and more severe problem around the world. More and more people are getting depressed, including me. So I wonder which market is your first market? Is Taiwan or maybe US and Europe?
We focus on the America, the US. So we attend the CES 2019 because the American is very interested in their brand. So and insurance is need to cost a lot of money. So we the America is the first we want to try to open the door. Yes.
Thank you. So US will be a really competitive market. and hope you do well. And for Assuretech, I think food allergies really is a big problem around the world. And you have working on an application to help those patients. But after the presentation, I'm not quite sure about your core competitiveness for the product because lots of people in Taiwan can't code the application. And so can you share about your core competitive of the product?
Yeah. So one of the big competitive advantages that we have is in the workflows that we've designed for the application. It's, for example, the translation. There's other applications out there that deliver translations for food allergies. However, they're all one-way communication. So it's me taking an application and just showing it to someone and hoping that they understand the message. Something that we're really doing to set ourselves apart is developing two-way communication streams within the application. And this helps really kind of close that gap and give the person with an allergy a safer experience.
Okay, so in medical device industry, the user experience and the communication is getting more and more important other than the hard technique. So I think this will be your competitive advantage over other products. So, hey, good.
Further elaborate on the two-way communication that he says that application can tell the user about the allergen, and what's the other way the user can experience with the application.
I'm sorry, with you?
Like, what do you mean two-way
Oh, sure.
communication?
Okay, so for example, when I eat out here at a restaurant in Taiwan, the existing application that we have and the other applications on the market, it says I cannot have X, Y, Z. In my case, I would put peanuts. I would show that to the person serving me the food, and then they would give me a head nod or depending on their level of understanding of English, and that's how we would communicate. What our application is doing, what we're working with a professional translation company to develop, is making sure there's opportunities for the person serving the food to communicate back and forth. And then, depending on their answers, the user, me in this case, would get a summary of what those answers were, and that really helps assess the risk level of the food that I'm delivering.
Thanks for sharing from the founders. Any questions for them? Okay, so maybe I can close this session right now and move on to other three startups. Thank you. Thank Cloudmed, Medjade, and Assuretech. Okay, next team, let's welcome Tsai. They combine traditional wisdom and modern neuroscience to improve people health. Let's welcome Tsai.
Ladies and gentlemen, the ultimate wearable device for sleeping syndrome, cardiovascular monitoring. Good afternoon. I am Tsai, sales manager for Tsai Incorporation. Can call me David. I want to introduce our company and the world's first patented X-ray technology for everyone. Our company was established in 2014 with a company amount $10 million. Our products, main product, wearable and wireless and wireless. We have acquired 100 patents and attained 35 patents. Ladies and gentlemen, I want to show you not money, it's X-ray. The X-ray experience the ultimate wireless device on your finger waiter set ground, single by Bluetooth transmission, app software support, Mac and Android system. We can support dear note block 14 functions. X3 was list ECG. What's difference? X3, X3 can single detection, single head detection, and finger to finger or finger to your head. The finger to finger low EMG noise and last artifact. Great explanation for analysis. The other, you can finger to chest, gently touch your body, your skin, from V1 to V6 and LL, and the finger to hand, to heart, to this head. Sorry. Our performance comparison with Philips hospital use 12 lead ECG based on what knowledge arrhythmia database and follow up MIT and AHA. This is hospital use original ECG report. 30 seconds. S-rim versus raised PVG, what's difference? Finger artery in center of capillaries, singles, SpO2 pressure, oxygen level, meditation, and 24-hour continuous agitation. Advanced sleeping apnea screener. The S3 with mobile phone linking and upload to cloud and transfer to doctor or hospital. Analysis report replay to end user. Our report including SpO2, pulse, and sleepy stage. What's more, S3 can support competitor meditation app, voice guided breathing training, and EDA biofeedback, temperature biofeedback, PPT based blood pressure, AF events, notification, HRV analysis for ANS assessment, smart wake up by vibrated motor. Sensine service include meditation, sleep, and cardiovascular. Preventive medicine, telemedicine, and telehealth care. We are all ready. Thank you.
Thank you, Science. And next, let's welcome Soteria Biotech. They provide complete solution for management of snoring and obstructive sleep apnea.
Perfect. Good afternoon, everyone. Are we sleeping right now, or are we still under the beer effect? My name is Clovis, and I am going to present to you today Soteria Biotech. It's an MIT, as you may all know, made in Taiwan company, 100% made in here. And we are focusing on the upper airways sleeping technology, and we are medical software developers. All right, so allow me to introduce ourselves. We are a small company made of or formed of 8 persons. And as Mr. Jerry said earlier today, We believe we have the perfect triangle since we have a doctor in our team working together with us, making the medical assessments on regarding the healthcare part. Our CEO is the one who developed the technology. He has been working for research entities since 13 years ago, and he was the one who was inspired to create this technology. And myself, a business developer, trying to be the bridge in between both worlds, engineering and business. Now, to understand our solution, we first need to understand what is the problem. What is OSA? OSA, as its name says, is obstructive sleep apnea. It is one of the sleeping diseases that is causing 85% of the sleeping disorders worldwide. So it means that probably 15% or 25% of our people in here can be affected by this disorder right now, and you don't know about it. It's, according to the experts, it's easier for them to identify these kind of diseases or these kind of problems, but not for the common people that have no education on health, all right? So what happens? It consists of the fact that you have obstructive upper airways and you're not having that facility that you normally are supposed to have for you to be able to breathe, all right? So Soteria Biotech comes out with this solution we call Soteria OA solution. What is it about? How does it work? All right. We trigger the effect of our solution by grabbing an image file from the DICOM. The DICOM format is the image we get from the MRIs or X-rays, all right? For this, we need the CT scans, combined CTs. Then, we grab this image and we bring it to our solution, our software. Our software is combined with AI algorithms together with computational fluid dynamics. So we analyze the image software, we do a 3D reconstruction. With that, we're able to give a doctor the diagnosis. Oh, sorry, no. It's not a diagnosis, it's a report. Why? According to FDA, we are a medical tool, medical device. Therefore, we cannot replace the human factor. So we cannot call ourselves a diagnostic tool. We are a report tool. All right? So we provide a doctor with information enough for him to know with an 85% accuracy if the patient has or not obstructive sleep apnea, and what kind of treatment is the one that is suitable for the patient. In this case, we all know for these kind of situations, we can have either surgeries, we can have CPAPs, or we can have the oral appliances. All right? This is how it works. We have been considered disruptive technology in the market. Why? Because we have no competitors as far as we know, according to our marketing team. And other pitches we have from judges have told us that they haven't known any kind of solution like ours. Why? We are combining, as I said, CFD technologies together with AIs. What happens in this situation? There's no other company combining computational fluid dynamics with algorithms from CNN focusing on the upper airways. There's only one company in the world focusing right now, but in the chest. Talking about the lungs, not the upper airways, which is the area from the trachea and your mouth and your mandible, all right? So, what are the benefits? The reason why we are disrupting technology is the fact that we are changing the healthcare system. How? By disrupting the golden standard. We're not trying to supply anything to replace anything in here, but what we're trying to say is that we are a better solution, a better offer services for hospitals and doctors, physicians, to offer for patients, because we reduce the time on trying to analyze and get a diagnosis from a patient, whether they have or not a sleeping disorder, in a shorter period of time than rather using the golden standard. We give the doctors a diagnosis in 15 minutes rather than months or weeks. All right, so what are the benefits in here? For patients, they don't lose time, for me not to say waste time, by going hospitals back and forward. Why? Because patients have to go to the hospital, get the first check-in, afterwards go to a sleeping clinic, then coming back to the doctor to get the results, and then begin a treatment. All right? So for doctors, they can improve the treatment. In this case, we would like to say that Soteria Biotech has a big commitment to see how we can give a big impact in the world right now. So thank you very much.
Thanks, Soteria Biotech. And the last team today is MLK Bio. They provide wound repair solutions for chronic and general wounds. Let's welcome MLK Bio.
Good afternoon, everyone. We're MLK, and we provide skincare for skin needs. Today, I'll introduce you the one and only skincare innovation, the Biomimetic Elastic Hydrogel. It is the best wound care solution in the world that promotes healing, relieves pain, and reduces scars. Have you ever had burns, had surgeries, or fallen down from stairs, or got wounds by tripping? Well, I did, and those are memories that I wouldn't want to recall. So what is it that caused us to hate wounds so much? First, waiting for healing is like hell. Second, the pain every time it touches something that hurts. And finally, what if I get scars from it? Well, I got scars everywhere. All in all, what we fear the most are the slow healing, pain, and scars. So can someone solve these problems? Shown here are the products, the dressings that we often see, in which hydrocolloids and hydrogels are the most well-known advanced dressings. However, hydrocolloids are dry and hydrogels are rather fragile, while we don't have those problems. Moreover, hydrocolloids are made of cellulose, which incubates bacteria, causing contamination, while amide hydrogel structure crumbles after absorption of fluids, making it hard to change dressings and also unable to treat with medicine. Apparently, those are what hospitals concern most. On the other hand, MLK's hydrogels, Colloiderma, is best in elasticity and moisture, which is the best solution. So the elastic lateral pressure promotes healing and reduces scars as cells may move faster and smoother, while moisture promotes healing and releases pain because cells may proliferate and also stimulations are blocked. So Colloiderma can also work as carriers for medicine, growth factors, or stem cells. And these are our post-surgical products, including the face mask. So the global wound dressings market size is 13 billion USD right now, and China is 2.4 billion. And recently, the Chinese government has initiated the Made in China policy to promote the domestic production in medical devices. So we're right now focusing on the China market, but we'll also be targeting the global market afterwards. And we now have the advanced medical cosmetology and wound care products. First, we'll initiate our post-surgical products, and then the skincare products, for example, acne patches. And we're now negotiating with some tier 1 clinics, shown right here. And from 2020 to 2022, we'll be focusing on our wound dressings and medicated dressings. And hopefully, we're now partnered with Huashan Hospital in China and Rongzhou Hospital in Taiwan, and also 2 big pharmacies, in which Huashan Hospital is one of the tier 1 hospitals in China. And we're also partnered with one of the big dressing companies shown in the competitors chart. So our R&D was a PhD in the University of Paris and also a postdoctoral research fellow in biopolicy. And therefore, he's capable of doing biocompatible material inventions, and he's also an expert in mechanical biology. We also have members' expertise in integration marketing, mass production, marketing, and salesmen, and also supply chain. So we're now raising 2 million USD, which is 25% of our stock, in which 30% is for R&D license patent, and we're now working on our mass production, and 30% is for the marketing development and operation. And we're estimating that will IPO in 2023. Thank you.
Thanks for MLK Bio's great presentation. And now is our Q&A time. So any questions for Sun Science, Soteria Biotech, and MLK Bio? And please take your seat. Any questions for the startups? Professor, TK and TL, or maybe Jerry?
One question for the gentleman. You say you are self-service. So far, is no competitor in the market, which imply or indicate the market is not attractive enough. So no vendor want to penetrate the market, or you have killer technology. But from your presentation, I don't see any, introduction or your market analysis or technology advantage. Like you have like a barrier you build to prevent other competitors to join. So can you give more explanation?
Sure. On regard to patents, we haven't limited ourselves in that part of stage yet because of the fact that our company only have achieved 2 of the patents from the 6 that we have as our scope for the time limit up to 2020. That's for the first side, talking about the patents. In regard to certifications, we have been already awarded the 510K. We are ongoing the ISO, and according to the FDA last report we have gotten, we might be awarded the FDA by the end of the year. On regard that side, we have based ourselves on pitches, feedbacks that we have gotten from participations we have had from judges from Palo Alto, MIT, Boston, Massachusetts, China and Singaporean markets, talking on the fact that why we don't join professional companies, competitors in these facts such as Philips or ResMed, since we could be sold pretty easily for them to be able to develop to begin to sell, since we are the ones who are needing the certifications to begin the commercial phases. So that was the key sign for us to realize that they were pointing at us through a solution that they do not have, but they know and recognize that it's needed for the market. We recognize it's a niche technology and it's a niche market. It has been extremely difficult for us to allocate our market. By now we are focused in Philippines. Why? Because in Philippines, regulations allow us to begin commercial phase without the need of having the FDA in this case, on regard our software, medical software. That is what can I tell you right now. We do not have reported any kind of revenue so far. Our ROI is going to be expected according to our VCs from now beginning on January of 2021, since we begin to develop the markets first.
Thanks for the question.
Okay, one question for this gentleman. Wearable device is very popular, maybe 5 years ago.
Yeah.
So your product, you position your product is consumer product or medical device. Because if it's medical device, you have to get some like FDA approval, but I don't see you have you don't go through all the process so far. So if just consumer product, I think it's a racing, it's a home hack in the market. It's not easy to
I answer your question, sir. Honda is our OEM. Our the other partners.
My home hack. Home hack is not. 不是那个红海，我讲红海是红海帮。
Sorry, I mistaken. Our the other products get the USA FDA approval, and then in Taiwan, many more than 100 doctors using our the other product. So we are all ready for consumer marketing and medical marketing.
So far, how many? I mean the market. How many you have sold? And what?
This is
I just
good
curious.
question. This is good question.
I produce product is easy, but to sell the product is easy.
Our company lost future money for this design. So we have planning our our sales plan. Maybe I will free for you.
As a VC investment team, all of you can recently introduce your financial frameworks to us.
I think after Shawn with the slides, so we're now launching our medical products, the post-surgical products, which are sold to clinics. And later on, we'll go on with our acne patches, and then when we get to launch our dressings, we'll be probably like get break even in 2020 or 2019, like in the end of the 2019. And so by the time when we're selling our medical dressings, it'll be easier for us because we'll have a lot of income by then. Yeah.
We're expecting an ROI of $5 million by 2023. Beginning revenue phases on January 2020. We're selling right now our solution by case, depending on which solution we are offering a service, and we're also having a contract with remotely companies, that's Amazon and Huawei. So that might accelerate the process of revenue.
Must be ask our boss.
Thanks for the question, and I think it's the end of our mini salon. Thank you everyone for attending the event, and thanks for our founders and employees from the startups. And I will give my time to.
So now.